A very good evening. I'm Lakshmi Ramya from Cohort 14 BMI. Today I would like to present about patient transfer method. What is patient transfer method? Patient transfer method is where a patient is moved from one flat surface or from a wheelchair to another placement. The purpose of this transferring is to permit a patient to function in different environments and to increase the level of independence of the patient. Patient transfer usually occurs when the patient is unconscious or only capable of helping transfer or only able to bear weight with at least one leg of theirs. These are the types of method transferring to patient. The first one will be transferring from wheelchair. The second one will be transferring from bending or stretches. Meanwhile, transferring from wheelchair has three types, such as standby assist, assisted standing plot, 2% belief. Firstly, we will see about standby assist transfer. Standby assist transfer is when the patient is capable of moving themselves from one place to another place, but the strength of the patient will be determined by the caregiver and also will still be given assist just to make sure the patient is safe while transferring themselves from another place to another placement. The guidelines for this method of standby assist transfer is inform the patient what are you going to do and the method of treatment. Make sure the patient listens to the guidance and ask if the patient needs any assist and still offer them to hold by the hand just in case they don't have while heading up to the next placement of theirs. Place the wheelchair at the position of 45 degrees angle near to the bed or actuator or any other placement of theirs. Make sure to place the wheelchair near to the footrest out of the way to make it easier for the patient to get on to their placement such as bed or actuator. Lock the wheelchair's wheel so that it will move and it will be easier for the patient while they are getting up to move to the next placement. Ask the patient to sit on the edge of the wheelchair seat and push down on their arms to rise up their body. And then ask the patient to reach out to the table with the nearest hand and turn until they feel themselves on the bed. Let the patient to hold on the table with both their arms and sit on the bed and then hold the X-ray table once they have transferred themselves. This will be the images of standby assist transfer. Secondly, we will talk about assisted standing pivot transfer. This method is when the patient is capable of standing up but isn't capable of moving themselves from the wheelchair or any other placement to another bed or to the actuator. This will need at least one caregiver to help the patient during this transfer. The guidelines for this transfer method is to inform the patient about the method and how is it done and the purpose of carrying out this method. Make sure to lock the wheel of the wheelchair and perform the sit to stand transfer. While in standing position, hold each other's side of the belt and hold the patient close to the body. Take a small step and rotate our body until the patient back is facing the X-ray table. Slowly squat and lower the patient on the X-ray table in seated position. These will be the images of assisted transferring pivot transfer position. Thirdly, we will talk about 2% assist transfer. This is when the patient is unconscious or doesn't even have the strength to stand up and is fully needed some caregiver's help to transfer them from one place to another place. This method needs at least two caregivers to help in the process of transferring. The first caregiver has to inform the patient. If he is unconscious, it's okay to inform the relative, but if the patient is conscious, it's a must to inform the patient about the methods that we are going to do and how is it going to be done. Secondly, the first caregiver has to stand by in the way of stand with the knees slightly fixed and the toes pointing towards the chair. Meanwhile, the second caregiver will stand behind the patient. The first caregiver will maintain the lumbar lordosis, lean forward and place the hand behind the patient's lower back, and the second caregiver also will do the same by placing the hand behind the patient's lower pelvis. This means that the first caregiver and the second caregiver will be holding the patient's lower pelvis from both sides, from the front and the back. Then, if it's necessary, the first caregiver has to lock the patient's weaker leg by placing their feet on the either side of the patient's feet and uses our feet to support the patient's weaker leg. This is to gain more strength for the patient while doing this process of transfer. The second caregiver will facilitate the patient to stand, swing their hips around the chair. Then lower the patient's body on the X-ray table. This will be the images of the two-person assist transfer. The standing up position, the lifting up, and swinging their hips from the wheelchair and transferring the patient from the wheelchair to the bed or the X-ray table. Lastly, we will talk about gurney transfer. Gurney transfer have three types: moving in bed, turning in bed, transfer between bed to X-ray table. Moving in bed is the method that can be done without extra assistance. It can be done with a single individual. The caregiver has to stand on the opposite side of the patient to be lifted. It's an advantage the caregiver can push the patient with their legs. This is usually when the patient is moving from one bed to another bed if the patient is found unconscious. Turning in bed requires two caregivers, and the method of being done is by two caregivers standing on opposite sides, and then the first one will move to the edge of the bed and turn the patient. Meanwhile, the second caregiver should encourage the patient to proceed with the process as soon as possible. The third one will be transfer between bed to X-ray table. This method is when the patient is transferred from the bed to the X-ray table. The caregiver can move the patient straightly across the patient, can be lifted from the bed and transferred. When using the lifted method, lift the patient by the legs and hips first. This to make sure that the patient is in the right position, followed by the upper part of the body, thereby reducing the load. Then use the feet and ankle to simplify the transfer. Before executing the transfer, make sure the scatter on both transfer points are locked. This is to make sure that the thruster doesn't move while the process of transferring, and it's for the safety of the patient. These will be the images of gurney transfer. Thank you. I hope you enjoyed my